Hello and welcome back to the Advancing Healthcare Innovation Show. I'm your host, Michael Stamatinos. And if you're new to us, man, we are pretty pumped to have you here because we're bringing some top-notch leaders that are incredibly passionate and painstakingly shaping the future of healthcare. And we're very passionate around innovation, adoption, leadership, and access. And if it's your first time tuning in, let me just sort of take a quick step back to share a little bit more about what we're doing here. So we're focused on bringing stories of innovation to life, and the aim is highlighting real people that are actually in the trenches getting stuff done and giving them the opportunity and the platform to be able to share their stories and wins and learnings with our community and the world. And we've got an incredibly action-packed year with just some incredible interviews that are upcoming. And if you haven't checked out any of the historical interviews, make sure that you hit the subscribe button now, wherever that is. And any of the new interviews will definitely be coming to your inbox. So our field it's evolving quickly, and it's critical to have leaders that not only can envision the future, but also embrace new ideas, and then also know how to influence people, how to influence policy and help innovation get deployed at scale. And our next guest is one of these leaders. So today I'm just really thrilled to introduce Robby Franceschini, Director of Government Affairs at Blue Shield of California. So his background is really interesting. He's got a blended sort of journey through the corridors of healthcare law and public health, and he's got a knack for being able to cut through the noise and get stuff done. And we'll dig into how he does that today, whether it's drafting legislation or leading an organization. So Robby's going to share some of his valuable experiences within the space, examine how policies can either speed up or even slow down innovation, and just kind of get his viewpoints of the future of healthcare, technology, policy, and sort of the confluence of all those things. So we're super lucky to have him, and he can kind of share more about his journey and the incredible work that he's doing. So Robby, it's great to see you. Welcome to the show.
Thank you. Good to see you again, Michael. Thanks for having me.
Yeah, so maybe we start a little sort of take a step back, because where you are now in terms of the seat that you're sitting in, there was a few different tours of duty. So would you mind maybe just sharing a little bit with the audience, a little bit of your background, your story, and who's Robby?
Yeah, no, happy to. Yeah, so kind of before I go back, as Michael mentioned, I'm a director of government affairs at Blue Shield of California, and in that role, really focus on state regulatory affairs. But I really got interested in healthcare back when I was working my first summer after law school. And I was working in legal services in New York City, the New York Legal Assistance Group, the largest medical legal partnership in the country, doing direct services. And this was in 2013. So ACA was rolling out, Medicaid managed care, right, was really ramping up. We had a lot of clients who were like trying to navigate the system from that perspective, as well as, dealing with medical bills and such. And I really was just intrigued by the idea of doing something bigger than direct services. I have so much respect for my colleagues who do that work. I thought that's what I wanted to do, but I realized, wouldn't it be kind of fun to figure out how does the system work and
Yeah.
how could I influence it? I had no clue what managed care was or Medicaid, much less. And so I went back to school and I started talking to the professors there at my law school around classes and research opportunities as well. I also started looking around at different nonprofits I could intern with. So I did that my next summer. I worked with a consumer advocacy group, actually, that has a large presence here in California where I'm based. And I also then got really involved in a lot of bioethics work, which
Mm,
was, a lot of my work right now is kind of in the health services space,
right.
right? But like, I found an amazing mentor in one of my law professors who was working on a couple grants. And, we were focused on this work from a legal perspective, while other teams were focused on ethics and doing a lot of social sciences research around how you do research with pregnant women. What is the pathway to doing that? Because historically, we've left pregnant women out of the biomedical research enterprise in terms of really thinking about including them in trials
Yeah.
and in studies. And that was just those were amazing projects to work in as well. I focused on that in my master's thesis. And then once I got out of school, I thought I'd come back to my home state of California and try to work in health policy here, which is how I ended up working consulting at Blue Path Health for almost 7 years, and really focused there on telehealth, health information exchange, Medicaid policy, amongst other topics. So I've kind of been dabbling all over healthcare and I get kind of biomedicine more broadly as well over the past 10 years.
It's an amazing story. So, I mean, you've done multiple tours. So you've seen now, working as a consultant, how have you been able to take some of those chops, some of those skills, and incorporate them as you are in this new, well, it's not a new environment, but it's just a different environment. Now you're sitting in a different seat. Talk about that.
Mhm. Yeah, I think a big difference is I kind of have one client versus a lot, to be honest with you. And I think you do when you're in-house, right? Like you're advancing a single agenda in a lot of ways versus I think in consulting it can get really difficult because you're juggling different clients' needs, which can get sticky sometimes in terms of figuring out like where their conflicts of interest, like how do you navigate those when they come up, make sure you're disclosing and such. I think when you're in-house, it's just a bit easier in terms of navigating those challenges. At the same time, you could also view different business units as your client, right? So there is still, I think consulting trains you well to think about how you can kind of obsess over and like meet the needs of your clients, whether you're in consulting or in-house doing work as well. But I think that honestly is the biggest difference. I think the other is just kind of having a pretty square focus on government affairs work versus I think sometimes in consulting, right, you have to wear a lot of hats at once to make the client happy. So it's more dynamic in some ways, which actually I think also prepares you well for future roles because you can put together strategy decks, maybe like I was, helping with legislative or regulatory matters, running meetings. Like you gain a lot of really good skills. But I think it does differ in some ways from other roles within companies where your role is a bit more defined.
Mm. So talk about innovation in general. Has your viewpoint of innovation as you were in consulting to where you are now, has it shifted, and what is it now?
Yeah, I don't think it's shifted. I think well, I kind of historically haven't really thought of myself as an innovator per se, but as I reflected upon things after meeting you, Michael, I realized I think I am attracted to working with people who are innovators. Like I like working with people who like to push the boundaries, right? So never say no to ideas. It's really kind of like, how could we make this happen, right? And I think back even to like when I was in law school, in public health school, and working on these research projects, like we were obsessing around how do researchers get their work done in terms of doing research with pregnant women. We're not focused on like how to not do that, right?
Right.
That's been explored ad nauseum, right? We all know how to not do something. It's quite easy. But in terms of thinking about like how could we get things done that will benefit society, right? Like that's the hard but really exciting work. And then I think about in my last role too, where we were thinking about how do we advance telehealth policy, how do you advance data sharing policy, and how do you do these things in a state that's as big as California, right? And then now I see that translating into my current role where we're tackling things like pharmacy, data sharing, and the like, big topics for a health plan to try to push on. And I think even in this role though, I'm working on a team that's like, how do we get this stuff done, right? Obviously, how do you do these things? within the bounds of the law and ethics and best practices, but like, it's a frame of mind in terms of thinking about like how do we get stuff done in that way, right? So to me, like that's really what innovation is like,
Yes.
being thoughtful and careful, but also like, feeling a fire under yourself to get stuff done and move the industry forward so that we can actually improve healthcare, improve access, or improve access to drugs, whatever the thing may be.
So who are the constituents that you're interacting with on a regular basis now? So you mentioned your internal
Yeah,
team, but who are the folks that you're really trying to get stuff done with?
yeah. I mean, a lot of business leaders, right, who are working on these transformation efforts are primary stakeholders. But I mean, even within that, right, we have lots of interdisciplinary teams across the company, right, that are assigned, say, to mandates, regulatory mandates, legislative mandates, and then also to special teams, tiger teams, strategy teams that are working on new projects that are not associated to, say, a specific mandate from an agency or the legislature. Excuse me. So it's super diverse. Like it could be folks who, are PharmDs and, are working at a health plan, medical directors, folks who like came out of management consulting. And then also to just, on my team, I also see my colleagues on the government affairs team as my constituents as well. So thinking about like, how can we work collaboratively together if I'm doing something on the state side and my colleagues doing something on the federal side, right? We need to make sure we're aligned on our
Yeah.
work. But like, like thinking about like how can we support each other with, ideas that we're generating on the state side and make sure like, hey, have we thought about this federally and vice versa? Like I find every week checking in, new ideas are generated, and then it's like, ooh, that's a really cool thing. Let's figure out how to like translate that into a policy advancement here, or it even could just be a soundbite that supports like some of our work that we're trying to advance in the state.
And where do you see some of the biggest blockers coming into play? I mean, I know there's probably a lot of myths that are out there around it, but like what's truly something that you're thinking about now that to the degree that you can share, by the way, that you're like,
Mhm.
man, we're running up against these barriers. What are some of those barriers like?
Yeah. Well, and from in my opinion, I think well, good example, AI, right? Everyone's talking about AI.
Yeah.
We have a
I
really
was
active
hoping you were
legis.
gonna go there, by the way, but I didn't want to
Yeah, well,
bait
it's
you.
it's a hot topic, right? But it's actually a good example or like use case for thinking about how policy gets made. I do think, there's high interest in figuring out how do we regulate AI. I think in large part because a lot of folks feel like perhaps we didn't do that adequately in other examples in the past around tech. um, I think where sometimes I see it, I'm like, in some respects, where we've gone with AI is new, right? But some of these applications, it's like we've been doing some of this stuff with software, right? Like some of it's not so new. So, I think it's really taking a step back and thinking about what is the problem we're trying to solve? What are the risks that we want to, minimize, right? In terms of reducing harm to people. That's the same. Honestly, I think back again to like clinical research ethics, like risk benefit analyses, and thinking about how you promote beneficence, which is like a principle in bioethics. Same kind of thing in this sense, right? Like, how do we make sure, benefit outweighs risk? And so, you know, I think a lot of folks often think about like the harms that could be done, but never think like, or not never, but the benefits, like giving consideration to benefits can come later. I think this happens a lot in law school too. Like a lot of times you're taught to say no, no, no. But it's like, how do you get to yes? And so back to my
Well,
earlier
sometimes no
point,
means yes.
sometimes, well, that's another issue. Sometimes no means yes, which is
Well, it depends how
uniquely
you frame
American
the
issue, though.
question. It depends how
Yeah,
you frame the question, right? If you're like, hey, is this a bad
exactly.
idea? No, no, it's not a bad idea. Well, you got them to say no, and they move ahead.
Yeah, and you know, I think a lot of organizations are being cautious about how they utilize new AI tools, right? Because, there's there's a magnifying glass and a spotlight on everyone right now in terms of how they're using AI, how might it harm people. But I think in this case, just like other ones in the policy environment, I think it's always like taking a step back. What is the problem we're trying to solve, right? Because I think sometimes folks get ideas, right, for any sort of piece of policy, and it's like, well, what's the problem, right? Like sometimes folks can't articulate that. I think that's number one. And number two is like, how do we make sure the benefits of whatever the thing is are fully realized and then minimize the risks? And I think this is such a good example, and perhaps we don't really know what all of them are. So I'll just say I'm excited to see, like, for example, what comes out of the California legislature this year related to AI. Because like I to be honest, I don't think anyone knows quite yet. It'll depend a lot on, say, what the governor passes, but that will definitely have effect on what happens in the rest of the country. But I think it will also tell us too about like some of these machinations, right? In terms of how legislators and stakeholders are thinking about those issues, the problem, and then, balancing the risks and the benefits.
So I love it how you talked about like creating these problem statements. In you and your team, do you have a list of these problem statements that you're working on and then prioritize them? And then based on the prioritization, set the strategy for how to maneuver forward any type of, legislature or what's the thinking behind that?
Yeah, totally. I mean, you have to, right? Like sometimes there's wiggle room, right? In terms of prioritization, I mean, I like to tackle everything, though I realize I can't. But yeah, exactly. I mean, sometimes these things come down, right? If you're in an organization, like, often government affairs is very responsive, right? So there's a business need that has like a policy fix associated with it, regulatory, whatever the thing may be, right? So like you're responsive in that respect. But I do think there's a role in terms of helping the business figure out like what is the thing we're trying to solve and like refine it, if you will. Not, I don't mean to say they're coming in without a problem, say, but you help refine it and think about how do you communicate this to external audiences. I think that's a key piece of that work. Also, that's a big piece of like a lot of work I was doing in consulting, right? Especially around coalition building, like
Yes.
trying to get folks together to figure out what's a problem we need to solve and then what's the solution. So to me, it's a very similar process in terms of like how you approach this work in these settings.
So share an example of when legislation was passed and innovation really sped up. Do you have an example that you can kind of pinpoint? And then on the flip side, is there a piece of legislation that was passed where it really sort of stifled innovation?
Mhm. So I think one example I would give around advancing innovation, I think, HIPAA is a great example. Folks
Yeah.
often think HIPAA is like there to stop data sharing, but really the intent is to lay the groundwork for folks to be able to share information that wasn't getting shared before, right? It lays out
Mhm.
really beautifully like purposes for which covered entities and business associates can share information, and with or without authorizations, often without, mostly, right? And then it goes into here's when it's required, permitted, prohibited. It's like a really nice framework. And to me, like that kind of clear articulation of the rules is really helpful. Now, of course, you're always going to hear folks say, well, I can't do anything because HIPAA says I can't share data. And it's like, well, not necessarily, like depends on the example. Give me the use case, right? And then we can kind of figure that out together. It's like, I think it's a very nice, like, or framework, right, for thinking about regulations. In terms of
I, I, re-
stifling,
I really like how you took something that can be perceived as a way of stifling innovation and you really sort of turned it on its head. And so I've never heard of anyone sort of articulate HIPAA that way. So I'm kind of taken aback in a really excellent way. So we heard it first here. So thank you for
well, I think
that.
what's cool about it, and like HIPAA provide like I mean, I told a colleague that I met in my new role months and months ago. I was like, I think it's really beautiful. And he was like, so do I. But it fits healthcare's needs really well too. Not to say we don't need to tinker with it, not to say we don't need additional protections in certain instances, right? But it like I think for those who know it and live it, like it's not that complicated. And you just have to kind of sit down and let it sink in, and then you're like, the light bulb goes off and you're like, this makes sense. Now I think, Michael, you're still gonna come across like the other out of 10 people you interview that are not me, like a lot of them will probably say it's stifled
Yeah,
innovation.
yeah,
But again, this gets back to like benefits and risks, right? And like thinking about like, you know, I think a lot of folks often will, the knee-jerk reaction is think like data sharing is harmful to a patient, and certainly in some cases it is. But I think what HIPAA recognizes is like in the vast majority where you have these regulated covered entities and their business associates sharing data, it actually benefits the patient, right? Like think about it in this sense, like, providers need to be able to share data to better serve their patients. If someone shows up in the ED,
that's right.
pull their prescription drug list. For payers, right, like it gets complicated because we can't rely on claims data for quality reporting, right? We need clinical data. So, like in that sense, right, we're thinking about an operations use case under HIPAA. Like it just like the framework works, I think,
Yeah,
for our needs. Now, where it gets tricky, right, is thinking beyond healthcare. So we're bringing in social services into this web. Sometimes they have their own laws. Sometimes they have, industry best practices that have different approaches to say like consent or authorizations, how they like to share data. You get to the wider world where we have other privacy laws, like in California, the CCPA and such, like, then it gets really tricky. How do you balance all these? And they take different approaches to like privacy. So I think that's where maybe at some point we like, how do we harmonize the laws?
yeah,
Not right now, but again, I think HIPAA is a really good example of like actually fostering innovation because it just lays out the rules of the road really well, I think.
brilliant. And then on the stifling side, anything that you've seen around that you think is worth mentioning?
Yeah, that one's harder in some respects. Um, I guess I'll just say generally, sometimes like I think very pointed pieces of legislation that are like very surgical fixes to surgical needs, like can stifle innovation, like rather than thinking about how do we come up with I think often like comprehensive frameworks to policy issues are better than super surgical ones because you end up often like preventing folks from doing something that otherwise might benefit folks. Like it kind
Yeah,
of stymies that larger policy conversation that needs to happen around like, all right, let's take a step back. Like we want to think about, for example, a reimbursement for a specific one-off thing. But like, hey, we actually have a whole suite of other services that maybe should get reimbursed. And how do we think about that? What are limits on it? Like,
yeah,
how are we even paying for this? Is this the right model? Like, should we be doing fee for service? There's like leads you down a rabbit hole
yeah,
sometimes of questions, but then it gets you to like, oh, here's actually how we can like rethink and remodel a slice of the system, which is way more impactful and I think innovative than like, hey, let's just like focus on like, adding a reimbursement code can be a big win in a lot of cases. And I actually don't actually, a lot of times organizations I've worked with, like that's what we're aiming for. But sometimes I think if those approaches aren't like well thought out, right, you often can like stymie innovation or end up defining things in ways that like are not going to be helpful and 5 or 10 years. I think telehealth's a good example where everyone was defining telemedicine early on and it had really specific definitions. And then we all had to go back and like change our state statutes, right? Because we're like, oh, it's telehealth now. It's not just medicine. And like it's way bigger than just a live video visit with a provider. So it's like, I think it's kind of thinking about how you can read your crystal ball and see what might be coming, which always
mhm.
is hard to do. But I think leaving that room, right, for innovation and things to be captured under what you're trying to tackle.
Yeah. I think having that bit of margin that allows you to take a step back and assess is something that's definitely something that we've learned that works. I want to sort of maybe take a step in a different direction. So someone like you who's got a lot of experience in this area and government legislation, we have a lot of emerging companies that come onto the show that oftentimes haven't even dipped their toe in the water when it comes to this. But these things can either sometimes make or break a company. How how would you sort of in a very simplified method maybe have a founder, what steps do they need to take to get themselves familiarized when it comes to dealing with government policies? You mentioned around coalitions. What's sort of a
Mhm.
simple way for them to sort of to dip their toe in the water without immersing themselves in this all day, every day? Because I can see that it could definitely consume them, and their focus needs to be
Yeah.
on, customers, innovating, delivering what they can. But I'm just sort of curious to get your take on it.
Yeah, I think there's a couple things. One is like I think just educate like if you're new to healthcare, right? Like go to conferences, tune into webinars. If you don't know what Medicaid is, like there are tons of explainers on all this stuff out there, right? Like and I remember early on in graduate school, like I was always consuming that stuff, right? You're like, what is employer sponsored healthcare and like the different types of that, right? Sometimes it's self-insured, sometimes it's fully insured through a health plan. Those have very different implications in terms of how they function and work and such, just as an example. So I think that's one is like go out there, talk to people, go to conferences, go to webinars, right? Like go to coffee with folks that seem like they're an expert in something you might be interested in, and talk to them to understand like what are they focused on, what is this thing you like, what is Medi-Cal versus Medicaid, like get the lingo down. I think the other is thinking about like it's like who, what, when, how, why, like why do you want to pursue this specific intervention in like a Medicaid population? Like I think those things need to persist. Understanding why you're doing like the business case for doing something will then lead you to figure out like at the same time what some of the policy implications are, right? And I think Medicaid to me is always a good example because it's like a state by state program.
Right.
It doesn't just have federal rules, but like there are also really focused initiatives within different states on things like quality, on things like addressing social needs, right? Or maternal health. Like a lot of states are focused on the same things, but maybe doing it in different ways. They operate differently. The landscapes look different, vastly different in different states in terms of just even how they've set things up with managed care.
Mm.
So I think like being smart on like what is the thing you want to do and why is that, like what's the business need that may be driven by policy, right? Because the state is ultimately like the payer. And like why that population, what's that need within there that will help benefit say a plan or an FQHC or whoever it might be. And then like how are you going to do that, and like how is what you're doing going to like meet the needs of say the managed care plan, the clinic, the consumer, whoever is kind of involved in this intervention of interest. Like I think just being really thoughtful around that, because sometimes I think folks just jump in and you know I think in my mind, because I was doing a lot of work in Medicaid before, like Medicaid is really fun, but you really have to be thoughtful about it, right? Like folks really want to jump into Medicaid, but a lot of folks in this country who are startup founders, like they've never been on Medicaid. They don't know what the system's like to navigate, number one. Like the delivery and financing system looks different. A lot of these folks may not have ever been in managed care and HMO, right? Like that functions differently than if you're on a PPO plan, right? So there's like
Yeah.
I think often like people's personal experiences in healthcare like come through and how they are founding companies and starting things, and like I think it's all about like translating that enthusiasm and excitement around doing something in healthcare with the reality of like, hey, here, let's figure out how the system works, number one. And number two, like for the different business players or the consumers are like, what are the needs? And I always think Medicaid's like a good example of that.
Yeah. Yeah.
Because so many folks have not touched that system. It's very different from, I think, the commercial space in a lot of ways.
Well said. I know we're kind of coming towards the end portion of our conversation. How do folks keep in touch with you? How do they follow your work? I mean, the work and the legislative work that you and your team are doing, just kind of give a little kind of commercial around that.
Sure. I mean, folks can feel free to reach out. Like, I'm always happy to chat with folks or meet up at conferences and such. Always stay tuned in the news. Like, then our next big, my company's next big, initiative might be coming out at some point or another. But also, too, I think just like, you know, uh, uh, I think just reaching out. Like, I'm always happy to help or talk to folks, or if I don't have the answer, which I usually don't have the answer, like happy to help folks kind of like connect with others. I think that has been a big joy of working in healthcare is like I have found folks to be really helpful. And one piece of advice I always have for folks is like don't be afraid to reach out or like, not harass people, but like follow
Yeah,
up and
yeah, yeah,
the worst someone can say is no, I don't want to meet with you. But usually, like, 7 times out of 10, you get a response and like it's always fruitful. And I think never say no to opportunities to like meet with people or pick their brain. I always find that has been helpful. That has been really helpful in my career.
Well, you took the thunder out of the last question is like, hey, what's the one action item people can take? Because at the end of the day, when you're thinking about innovation, it's about movement. It's about taking something that is potential and making it kinetic and taking the right types of action. So this has been a
Yeah.
really fun conversation. Obviously the door is always open for you to come back and share more of your work. And for those that have tuned in, if you found this conversation particularly helpful for you, and personally, I found it very helpful because you were dropping a lot of golden nuggets today, Robbie. So appreciate that so much. But if others found it helpful, yeah, my ask is, would you mind sharing it on social media and even indicating, hey, what was something that stood out for you that you're going to take action on? Because again, it's about taking action and moving things forward. So I'm looking forward to our next chat, Robbie, and thanks for coming on again.
Thanks. Same here, Michael. Good to see you.